All right, so how does our breathing work? And why is it important for healing the pelvic floor and the abdominals? The basics of breathing mechanics just come down to the diaphragm and how it impacts the pelvic floor. So the diaphragm is this big muscle. It's a muscle. And it attaches to the entire rib cage. You can see it attaches to all the ribs. And when you inhale, it creates pressure by contracting down to let the air in. Otherwise, we won't let the air wouldn't get in. Okay, so the diaphragm, when you have in your rib cage or here, it goes down, air comes in, and then on exhale, it relaxes to push the air out again. Okay, so the movement is slight. Again, on inhale, it goes down. On exhale, it goes up, basically. How does it impact the pelvic floor? Obviously, the pelvic floor, when you look at it, there's pressure on the inhale, there's pressure down. So the pelvic floor needs to relax on inhale and go down a little bit to accommodate the inhale, the air that came in. So on the inhale, the diaphragm goes down, rib cage expands, and the pelvic floor goes down. On the exhale, the diaphragm goes up to push the air up. The rib cage contracts also to compress the lungs and get the air out, and pelvic floor goes up. This is the natural ebb and flow of breathing. And as you can see, the diaphragm works with the pelvic floor. And so in order to get our pelvic floors healthy and also diastasis, you need to restore this natural breathing pattern. And this is the first step in the healing of pelvic floor and diastasis. And that's why it's first we do the breathing in the program first. So what is the correct breathing pattern? Maybe you've heard of belly breathing, like in yoga. It's frequently said like inhale into your belly. That is not entirely correct. And if you have diastasis, you should be really aware of not breathing into your belly. The correct breathing pattern is called 360-degree breathing, because your rib cage, imagine your rib cage, it should expand in all directions, 360, like a balloon or like an umbrella. Imagine when you blow into a balloon, how it expands, all directions, so front, back, and sides. Umbrella. When you open an umbrella, it expands front, back, and sides. So when you breathe, your rib cage should expand your front, a little bit of belly, a little bit of chest, a lot on your side, and a lot on your back. So that's the correct breathing pattern. What happens if we don't have this correct breathing pattern? These two are the most typical, more frequent and more common incorrect breathing patterns. It's the belly breathing. So for example, you can see this lady, when she would inhale, all the air in would go into her belly, and that just strains the her diastasis. So the fascia that's between the rectus abdominis bellies that connects the abdominal wall and connects the rectus abdominis, that's the linea alba. If you inhale, and it goes into your belly, with every inhale and exhale every single day, you're putting pressure onto that tissue. And so that's why it cannot heal. So that's why you have to first restore a correct breathing pattern. A second type is shallow or chest breathing. You can see that where the arrows are, I'm really tight. I'm gripping with my upper abs. So when I inhale, the air doesn't go down. My pelvic floor cannot respond, because the air doesn't go down and goes into my chest, into my shoulders, and into my neck, which creates neck pain, tension, headaches, and so on. So this is very important and the first step in the healing process.